Learners, you may proceed.
Come in.
Hi there, Miss Moore.
Yeah.
My name is Jacob.
Hi.
I'm a second-year med student, and I'm going to be spending some time with you today, taking medical history, and then doing a focused physical exam. Does that sound all right?
Sure.
Okay. Do you have a preference for how I refer to you?
Alex is fine.
Okay, perfect. And of course, you can just call me Jacob.
Mm-hmm.
So I saw that you had some weakness that brought you in today. Could you tell me more about that?
Well, twice recently, just in the last week, I've had this weakness. It happened yesterday, kind of fell getting into the elevator, and this morning at home.
All right. And can you tell me a little bit more about both of those incidents? You said yesterday was when you fell getting into the elevator. Kind of what was happening?
Well, I just, when I was getting into the elevator, just stumbled and caught myself on the wall.
Okay.
And this morning, just kind of stumbled on the carpet in the bedroom and caught myself on the dresser.
And that was this morning.
Mm-hmm.
Okay. And have you ever had any issues with stumbling like this before?
Well, most recently this last week, but I had that weakness before.
Okay. Can you tell me about that time you had weakness before?
It started probably about 3 years ago.
All right.
I started noticing it about every 6 months or so for several weeks. I just feel like my legs can't give out.
Okay.
And then it goes away till the next time. So every 6 months, just now it was like the last 2 days last week.
So if you don't mind my asking, what kind of prompted you to come in today? Because it sounds like this has been going on for a little bit now.
Well, I kind of thought maybe it's just being clumsy in the past, or just get tired or whatever, but just concerning me now that maybe is it getting worse, and I almost didn't catch myself in the elevator yesterday.
That can definitely be scary.
Mm-hmm.
All right, so I just want to dig a little bit deeper here. Have you noticed any additional symptoms that you've had around these stumbling events?
The only thing that when I'm having the weakness, I feel like I'm walking on cotton.
Okay.
Kind of
No, that's a great description. So we'll definitely make sure to take a closer look at your legs and your feet when we do the physical exam. Anything else like dizziness, any like vision changes or anything like that?
I don't have any vision problems currently. I did have something in the past.
Okay, could you tell me about that?
That was about, like 8 years ago.
Okay.
I started having some blurred vision in my left eye. It was just getting worse every day, and after about a week it was really bad, and I was getting some dull pain in that eye too. So I went to the eye doctor, and we did vision checks. Vision was down in that eye. He gave me some pills for some inflammation.
Okay.
He said it was, and it cleared up over, of course, for the next several weeks, and it was pretty much back to totally normal in about 2 months.
Okay. Yeah. No. Thanks for sharing that.
Yeah, and I've never had anything like that before. So.
Okay. Yeah. So these other episodes in the past, just to jump back for a moment, about how long did those last? Were they kind of just isolated incidents of like clumsiness?
Yeah.
For those every 6 months?
Just for several weeks. but I would kind of notice it.
Oh, okay, so it'd be kind of like for a week or so that you have stumbling here and there, and then it would resolve. Okay. And when you've had these incidents of stumbling, have you done anything that you noticed made it better for you? Have you like taken any steps, taken any medications?
No.
Okay. And anything that you notice make this worse for you, make you more likely to stumble?
No, just kind of happens.
Okay, yeah, definitely. And you mentioned feeling like you're walking on cotton when these events occur. Has that kind of occurred with all of the stumbling?
Pretty much. It's just something when I have a weakness and then stumbles, and I kind of notice I'm being more careful when I walk.
Yeah, definitely. Okay. Anything else about kind of the quality of these episodes that you can share with me?
Such as?
Just anything else that you might notice around when they onset? Or?
No, just kind of, like I said, it just kind of happens when I stumble like that, and just kind of worrisome just because it's happened twice now.
No, definitely. And I think, our goal for today is obviously to get some more information and better understanding what's going on so that we can help you feel 100% again. In terms of the weakness, so you're getting it in your legs and feet. Can you give me a little bit more specific detail, perhaps, on where in the legs? Is it isolated to a certain part of your leg, or is it kind of just all throughout?
Just, I don't notice it. I just notice it like when I was just kind of my legs give out.
Okay.
Because it kind of happens so suddenly.
Yeah.
I think when like in the elevator yesterday, I just caught myself, and that was kind of scary because I almost fell.
Yeah.
It wasn't as if I was careful up until I felt anything.
Right. It just kind of came out of nowhere.
Yes.
Okay. So, again, and not to push the point too much, when your legs give out like that, do you feel like it's kind of the whole leg, or do you feel like maybe from the knee down, or?
I don't really.
Don't really know.
Yeah. Don't really
Yeah. No. That's fairly typical with things like this. All right. I'm gonna check in on just a couple other symptoms that might be specific to your leg weakness, and you can just tell me yes or no on these. Have you had any recent headaches?
No.
Okay. Any numbness with this weakness?
No, other than like my feet feeling that way.
Right, definitely. So obviously weakness is what we're investigating. Have you noticed any tingling?
No.
Tingling sensation? We already said there was no dizziness, right?
No.
Okay. Any episodes of passing out or fainting?
No.
Feeling like you might faint?
No.
Okay. Any difficulty with balance or walking?
When I'm having an episode, I'm more careful.
Okay.
I tend not to want to go outside because I would be afraid of falling.
Definitely. Have you noticed any changes in memory or problems with your memory?
No.
Right. And any seizures or history of seizures?
No.
Okay, that's good to hear. Alrighty. In terms of the time course of these stumbles, you said they were every 6 months, kind of for the past 3 years, and then you had 2 recently, yesterday and this morning. So do you feel like it's been a pretty steady frequency, and now it's getting more frequent? Is that?
I guess
Kind of
that's what
happening.
brought me in, because you were saying in the past I thought, oh, you're just kind of clumsy. It wasn't really super noticeable, but this was, I said twice, and I almost didn't catch myself. So.
No, we definitely want to figure this out because that could be dangerous. Do you have any particular thoughts about what might be going on?
Yeah, I really don't know.
Yeah.
I haven't been able to think anything about it, so.
Yeah, no, understandable. And, what do you feel like concerns you most about your leg weakness right now?
Just that it could be getting worse. It's happening more frequently.
Can you tell me a little bit more about how it's had some effect? Has it had any effects on your life so far? It sounds like you're a little more cautious.
Yes, I'm a little bit more hesitant about just being outside and out and about on my own and something, just because I'm afraid of falling.
flesh out the whole picture here,
Okay.
get a better idea. So could you tell me about any past medical problems that you've had, or any current medical diagnoses?
I'm really pretty healthy. I
Okay.
did have some kidney stones just 5, 6 years ago, but they just increasing in fluids and stuff just kind of passed on their own. But other than that,
Okay. Any hospitalizations?
just for my 2 children.
Okay.
That's it.
And were those C-sections, vaginal deliveries?
Just vaginal, no,
Okay.
no problems.
And when were those?
Well, my kids are 25 and 27, so.
Oh wow, kind of like just around my age.
Mhm.
Great. Boys, girls?
Girl and boy.
That's fantastic. All right. So you have no other, current medical diagnoses either, like high
No.
blood pressure.
No.
Okay, cool. Always good to check.
Mm-hmm.
But it's great that you're otherwise healthy. We always like to see that.
Yeah, try to stay healthy.
Yeah. How about any past surgeries?
Just tonsils out when I was 5 or 6 years old.
And nothing since.
Mm-mm.
And no like overnight stays in the hospital.
No.
Okay, fantastic. How about any medications that you're currently on?
Just multivitamin once a day.
Okay. And any over-the-counter medications
No.
other than the vitamin?
No.
Any herbal supplements?
Mm-mm.
Okay, good to hear. How about allergies?
Penicillin.
And what reaction do you get when you
I
take
get a rash
penicillin?
with it.
Okay. All right, next I'm going to ask you a couple questions about your family history. Do you have any family history of diseases that you know of?
Well, my mother has high blood pressure and high cholesterol.
Okay. And how old is she?
She's 75.
Okay.
And my father, he passed away 20 years ago. He's 55 with a stroke.
Oh, I'm sorry to hear that. And you said he was in
55.
his 50s?
Mm-hmm.
Do you have any siblings?
I have a sister.
Okay. Any medical conditions there?
She has rheumatoid arthritis.
Okay. Anything else that comes to mind in kind of a near family?
Well, my mom's aunt had rheumatoid arthritis too. But
Okay.
other than that, nothing I can think of.
Always good to flesh that out. How about any history of cancer,
No.
diabetes,
Mm-mm.
heart disease?
No.
Okay, great. Close to the end here, just going to ask you now a couple questions just about your living situation, your social background. Can you tell me about where you live right now?
With my husband, we live here in Ann Arbor.
Oh, that's great. Is it in a house, an apartment?
Mm-hmm.
Okay. And who do you generally rely on for support when you get sick or things like this?
My husband,
Okay.
closest one guy.
And can you tell me about what you do day to day?
Well, I am an elementary school teacher, 2nd grade.
Wow, that's fantastic.
Yeah, keeps me busy.
I'm sure it does. I was actually a high school
Oh,
teacher
really?
before I came to medical school, and I
Mhm.
couldn't even imagine teaching the little ones.
Just about the same.
Yeah. There's just so much energy.
Yeah.
And how long have you been doing that?
Oh, geez. That's probably over 25 years now.
Wow. Very impressive.
Mhm.
How about your alcohol use in
I
kind of a given week?
Yeah, I don't drink. Just
Okay.
very.
And do you smoke?
No, never smoked either.
Never smoked. That's what we like to hear as well. Do you use any other drugs?
No.
Okay. Have you traveled at any point in the past 12 months or so?
Not the past 12 months, no.
Alright. How are you feeling about your nutrition?
Pretty good.
Yeah?
Keep an eye on it. We're pretty healthy and try to stay
Alright.
active.
That's great. Tell me a little bit more about how you stay active.
Well, I do try to do exercise. It's been a little bit with leg weakness.
Oh, sorry. Do you mind if we take a few more minutes to wrap up?
No, that's fine.
Okay.
But I'm sorry.
Yeah, no worries.
Yeah, so we stay active and I just do a lot of walking and hiking and things.
Okay. Excellent. And sleep? How's your sleep?
That's good.
Yeah, you feel like you're getting enough?
Mm-hmm.
About how many hours a night?
Well, yeah, it depends. Maybe 6 to 8.
And are you sexually active?
Yes, with my husband.
Okay. And how many partners have you had in the last 12 months? Would you say?
Just my husband.
And do you feel safe at home
Mm-hmm.
and in your neighborhood and your general
Mhm.
environment? Alright. Have you been feeling at all depressed or anxious
No.
lately?
No, just got a little anxious and that was it.
Yeah, I know. Yeah. Understandable. We want
Mhm.
to get this figured out. And any other stressors in your life right now?
No, usually pretty, work everything pretty well.
That's excellent. That's
That's
good to hear. All right. Well, the last thing I do before we move over to our exam is I'm going to ask you a couple more of these yes/no questions, just running through some basic symptoms that we wouldn't want to miss and that could potentially help inform what we're trying to figure out today.
Okay.
So, have you had any recent fever?
No.
Okay. How about chills?
No.
Any changes in appetite?
Mm-mm.
Changes in weight?
No.
How about fatigue?
No. Mm-mm.
All right. Night sweats?
No.
All right. Any head injuries?
No. Mm-mm.
Hearing loss?
No.
How about ringing in your ears?
Mm-mm.
Any loss of sense of smell?
No. Mm-mm.
How about changes in vision other than that episode 8 years ago?
Nothing currently, no.
Okay. No, like double vision or
No.
loss of vision?
Mm-mm.
Okay. Any chest pain?
No.
All right.
Mm-mm.
How about shortness of breath?
No.
Swelling anywhere?
Mm-mm.
Right. Cough?
No.
Wheezing?
Mm-mm.
How about any nausea or vomiting?
No. Neither.
Abdominal pain?
No.
Constipation or diarrhea?
Mm-mm.
Any changes in urinary frequency?
That's been a little bit when I have these episodes.
Mhm.
I find myself having to go to the bathroom like every hour.
Okay, yeah,
A little
that's
bit
good
more
to know.
frequency.
Yeah, glad we caught that. Any pain with urination
No.
or blood that you've noticed?
Mm-mm.
Okay. How about any changes in menses?
No. Mm-mm.
Um, any muscle aches?
No.
Joint pain?
No.
Stiffness?
Mm-mm.
I know I'm just gonna ask you about everything here. How about any rashes or skin changes?
No.
Alright. Almost done here. Any insomnia?
No. Mm-mm.
Bruising that you've noticed?
No.
Alright. And that's all I really want to ask you about there. Do you have any additional questions for me right now before we
No.
move on to the
I
exam?
don't think so.
Alright. Well, let me just quickly introduce you to Dr. Craig here, who's going to watch us do the physical exam.
Nice to see you.
Dr. Craig, this is Miss Alex Moore. She's a 57-year-old female. She's here today for some intermittent leg weakness that she's been having really kind of for the past 3 years now on about every 6 months basis. And more recently, she had an episode yesterday and then this morning. And so she figured she should come in and get it checked out. So that's what we're going to do.
Okay.
All right. So you can go ahead and just hop up on the table here. And we're kind of just going to go head to toe and assess for muscle strength as well as kind of general sensation. Basically looking for the types of things that might be contributing to this weakness. Does that sound all right? Okay. And some of these maneuvers can be a little uncomfortable, and sometimes you're going to have to close your eyes for maybe extended periods of time. So just let me know if you're feeling dizzy or uncomfortable, and we can take a break and regroup. Okay? Sorry. All right. So when we were just talking, it seemed like you were speaking fine, no problems with language or fluency. Have you noticed any changes recently in your ability to speak or find
Faculty
words?
enter the room.
Okay, fantastic. Well, the first thing we're going to do is a few maneuvers to test your eyesight, especially since you've had some eye problems in the past. So we're going to just use the standard eye chart here, and what I'm going to ask you to do is just cover one eye entirely with your hand. And if you could just read the lowest line here for me, if you're able.
LTFPH.
Very good. Much better than I would do. And then go ahead and cover the other eye. And if you could read that line again, if you're able.
LTFPH.
Okay.
Right.
Was there like a little bit more
Just a little
trouble?
dry contact.
Right, right. Totally understand. Okay. So your vision's great, 20/20, and you do wear contacts, you said, which is just good to note. The next thing we're going to do is test your visual fields. And so to do that, I'm just going to have you cover up one eye again. Okay. And I'm just going to hold up my fingers like this, and I'm going to wiggle one or both of them. So if I'm just wiggling one, you can point to the one that I'm wiggling, and if I wiggle both, just say both. All right? Perfect. And then if you could cover the other eye, and we'll do the same thing. Over here. Perfect. Very nice. So everything seems to be normal there. Have you noticed any drooping in your eyelids at all?
No?
They look fine right now, but you know that's just something that we like to check for. It can be due to certain kinds of nerve disorders. All right. So the next thing I'm going to do is turn off the lights, and I'm going to use my pen light to look at your pupillary reflexes. So what I'm going to ask you to do is just find kind of a point right out on the wall, and just fixate on that. And I'll just be sort of the lighter on here. Okay, so what we like to see there is that your pupils are nice and round and equal in size, and that they constrict with light like they should. And that's what I'm seeing here. So that's great. Next thing is I'm just going to test the function of your eye muscles and your ability to follow an object. So I'm just going to use my finger, and I'm going to ask you to start by just staring directly at me and at my finger, and I'm going to move it around and just follow with your eyes, all right? Alright, very nice. And you were able to follow that entirely, and no signs of any muscle twitches or anything else like that. Alright, last thing I'm going to do with your eyes is I'm just going to hold up a finger, a thumb, and then ask you to point, or actually not point, but look with your eyes at one of them, okay? Just to see how you can shift your gaze. Alright, so go ahead and look at the index finger that I'm holding up. Alright, and look over to my thumb, and look at my nose, and then look at my finger. Perfect. As we're flying colors. Alright. So the next thing I'm going to do is test for muscle function and nerve sensation in a few parts of your face and your head. So if you wouldn't mind closing your eyes, and I'm just going to lightly touch on either side of your face, and you just tell me if the touch feels the same or